I experienced my first symptoms of endometriosis when I was 8 years old, and it first materialised as bladder symptoms. We didn't really know what was going on, there wasn't any infection, and at the time I was taken to my family GP and it was kind of a mystery. When I was 10 I had my first period, and then I had quite debilitating period pain along with the bladder symptoms. Again, went back to the GP and it was just, this is one of those things, painful periods are normal, and this is how unfortunately it's going to be for you. As the years went on, all these additional symptoms started to creep in, which kind of muddied the waters a lot of the time, because I was having all these symptoms and they were all being looked at individually, but nothing was being looked at as a whole picture. So I shared those symptoms just on social media, and a lot of people got back in touch with me and said, you have all the symptoms of endometriosis, have you ever heard of that before? And it had never been mentioned to me as a possible cause. And that was kind of the first time I heard endometriosis, and I thought, okay, this is the light bulb moment, that sounds like me, we need to find out if this is me. When you don't know what's wrong with you, you don't know how to ask for help, you don't know what treatments are available, and it's kind of hard to seek support as well. There is this misconception that it is not like debilitating, that it is, just menstrual pain, that it's just cramps, or that there's this association with it just being during the menstrual cycle, and it doesn't really, I guess, give the severity of what people are going through. I have had to seek private treatment throughout my journey to get endometriosis diagnosis and also endometriosis surgery. We used family money. My husband and I were going to get married, so we used the money we were going to use for our wedding. And the second one we crowdfunded. And purely the reason for that was one, barriers trying to access referrals or to be able to access a diagnosis through the NHS, through waiting lists or normalising of the symptoms. So, again, a lot of the time, because no one really knew what was going on with me at the time, the symptoms were kind of normalised. Years were going by to get the referral, to see somebody, to get referred for tests, to then be told that test is clear, to then go back to the beginning and start the process all over again. I was diagnosed with endometriosis in July 2019. It does change things hugely, and that I know what's going on in my body, but it is kind of always a mystery regarding the pain. Will it reoccur? What's going to happen? What are these symptoms? Is this symptom related to this? Is this symptom related to that? Endometriosis is an uphill battle, from just getting a diagnosis to getting someone to listen to you, to firstly hearing the word endometriosis, and then to try to access the care and access the support that patients should be able to get in a timely manner. We need to bring down the waiting lists. We also need to ensure that all frontline medical professionals are upskilled so that they recognise the signs and symptoms of endometriosis so that they can refer on. And we need to be able to just have those open conversations. And we also need to basically push back on the misinformation that endometriosis is period disease or menstrual disease. It is a whole body condition that can impact you in so many different ways. And we just really need more emphasis and education.